It's an honor to have him here, and Jeremy, thank you very much.
Thank you. So, real quick, how many of you exercise on a regular basis? Okay, that's good. That's more than what I've normally had in a group to say. So that's good. So let me ask you a question. How would you feel if I were to ask you to walk from your living room to your bedroom, from the parking lot to the grocery store, or out to your car right now? What would be some of the symptoms you would have? Or shortness of breath? What else? Yeah, hips hurting. What else? Fast heartbeat. Good. What else? I know there's more than that. Take twice as long. Good. So a lot of the reason I asked you this is I ask our patients this all the time when they start pulmonary rehab with us. I'll say, how do you feel, or what are the things that give you the most problems or the most difficulties? And it's always something that I take for granted. It's, taking a shower in the morning, or it's putting my shoes on and tying them up, or it's taking my lab outside for just to send her outside to open up the door so she can go to the bathroom. Those are the things that I hear a lot of people say that, I just have a struggle with just normal daily activities, okay? And a lot of what they'll tell us is, I'm breathless, I'm tired, I'm weak, I'm dizzy, I get frustrated, and I'm scared. All of those things wrapped up in one. They always come back to these primary things. Well, why is that? One of it is just the nature of pulmonary disease itself. Okay? Chronic disease, no matter if you have heart disease, no matter if you have pulmonary disease, no matter if you're overweight, no matter if you've got chronic pain issues, these are a lot of what people will tell us when they come in to see us for the first time. I'm breathless, I'm tired, I'm weak, I'm dizzy, I get lightheaded, I don't feel like I can do it. Well, the other part of that is a lot of our patients that come in to see us are just deconditioned. And what I mean by that is simply you have an issue that keeps you from preventing you from being active, or it makes activities really, really hard for you. So what do? Do you do them, or do you find another way around it? Find another way around it. Most of our patients will come in and say, you know what, it tears me up to go to the mailbox. So I say, well, what do you do now? Well, he says, I don't go to the mailbox anymore. Well, the next thing will be, well, okay, if you don't go to the mailbox, the next stage will be, I don't vacuum, or I don't go for a walk anymore. They find other ways around it. So what happens when you're not active? You lose a lot of muscular strength, you lose a lot of endurance, you lose a lot of stamina. You increase your risk for developing other chronic diseases. It may not be pulmonary disease, it may not be cardiovascular disease. It could be something as simple as you increase your risk for having type 2 diabetes. Your blood pressure begins to go up, your cholesterol gets out of whack, depression and anxiety. That's a big one with a lot of our pulmonary patients and also our cardiac patients when they come into our programs, is they'll be, walking around one day thinking everything is fantastic, feel great, doing well, get sick, it lingers on for a little while, they go to the doctor and they find out they have COPD, or they find out they have emphysema, or maybe they find out that they've got an aortic valve that's messed up and they've got to have surgery to have it replaced. So we have a lot of patients that come in that they say, hey, I just don't feel like I can do the things I need to, so I'm more nervous, I'm more anxious, I'm a little bit more depressed. ADLs, that's a big fancy abbreviation we use called activities of daily living. So think of anything that you have to do at your home right now, whether it's wash clothes, unload the dishwasher, vacuum. The only reason I say unload dishwasher and vacuum was I saw my wife's list for me when I got home today. So I got to unload dishwasher and vacuum on our minds. But those things become harder to do. Everybody in this room right now has activities of daily living that you have to do. Mine may be totally different than yours. Yours may be totally different than the gentleman back here with the Alabama shirt on. I'm a Bama fan. I don't want you to realize that. I am an Alabama fan, okay? Sometimes you got to make hard choices in life, and I had to go to Auburn. But they become harder and harder for you to do, okay? Well, it's kind of like a spiral of inactivity. And this looks a lot bigger for me standing here. I hope everybody in the back can see it. But what happens is you start to have shortness of breath when you're exerting yourself. Well, then what happens is you begin to do less activity. That leads to, I'm not well conditioned. I get more out of shape. That leads to more shortness of breath doing other types of activity, okay? That leads to further inactivity. Well, I'm not going to do 1 and 2, So now I'm going to stop altogether. The deconditioning, it becomes worse, okay? And that spiral just continues and continues and continues. What we want to do with activity, though, is we want to try to break the spiral of inactivity. So what are some of the benefits of exercise? What were some of the things that you thought of earlier that I said were possible? Definitely. That's a big one right there. What else? Taking a hot shower. Absolutely. What else? Gives you energy. Perfect. What else? Somebody over here said something. Getting out of bed. Absolutely. So think about it. What are the benefits of exercise? Let's go from it from a kind of like an exercise science part of it. Weight control and weight management. We have a lot of patients that come in that maybe they're looking at getting put on the lung transplant list. Doctor comes in and says, hey, you're a perfect candidate for a lung transplant. Only one thing's holding you back. It's your weight. We have to either help them lose weight. We have to help them maintain their weight. We have some patients that come in that we have to help them try to figure out a way to gain weight when they come in to see us. Reduces your health conditions and certain diseases. Think about it. Exercise helps lower blood pressure. It can help lower your cholesterol. It can reduce your risk of having type 2 diabetes. And it can help prevent some types of cancers. Unfortunately, exercise cannot cure heart and lung disease. Some of the healthiest people I know have had pulmonary issues. They've had heart transplants. You know, they go in and maybe catch a virus and all of a sudden they're sick and have something else going on with them. Improves your mood and depression, increases your endurance and increases your energy level, increases your chances of living longer. Dr. Millstone mentioned that earlier. Your activities of daily living become easier. You can do more things without getting as short of breath, and also increases your muscular strength and muscular endurance. One of the big things that a lot of patients will say to us when they come in to see us, especially our pulmonary patients, is, my problem is not getting the groceries out of the car. My problem is getting the groceries out of the car, into the house, and then unloading them. So what we try to do is focus on, okay, it's not just a strength issue, it's not just an ADLs issue, it's an everything issue. We try to incorporate all of that into their exercise program when they come to see us. So what is exercise? It's activity requiring physical effort. It's not cutting your grass, it's not vacuuming, it's not washing your clothes. Those are activities of daily living. Those are things that you have to do. Those are things where we can be physically active. Exercise is activity requiring physical effort carried out to improve or sustain health and fitness. So walking on a regular basis, walking 30 minutes a day, walking 10 minutes a day, 3 times that day. It's weight training, where you can improve your bones, you can strengthen your muscles. Flexibility. How many of you do yoga or Tai Chi? Anybody? One? Anybody else? It's fantastic to increase your flexibility. We don't need to be gymnasts, but what we do need to do is be able to do the things that we need to do during the course of a day. And that's where a lot of these exercises can come in. Probably the best thing that any pulmonary patient, or anybody for that matter, in my opinion, can do is walking. Because you have to walk everywhere we go. In some form or manner, you have to walk somewhere that you need to go. Swimming is great. Somebody earlier alluded to hips. We have pulmonary patients that they come in, and after a couple of sessions with us, we'll put them in our warm water therapy pool, put a tank on the outside of the pool, strap a 50-foot hose to it, and just let them walk back and forth during the pool. Best exercise they've ever done. It's low impact, doesn't hurt. They can get in there, and it doesn't cause any problems. The pool is only 4 feet deep, so we don't typically have to worry about a lot of things bad happening. But they love it. They love being able to get in that swimming pool. But we typically hold that for patients who maybe they have bad hips, they have bad knees, bad ankles, some sort of orthopedic problem that may limit them being able to get out and walk on their own. Cycling is another great form of exercise. Again, it can be low impact. You can use a recumbent bicycle. You can use an upright bicycle. Weight training, it doesn't have to be fancy equipment that we're going to talk about here in just a few minutes. It can just be a couple of bottles. I see bottles all the way around here. Pick these bottles up, fill them up with water, put them in a Walmart bag, and there you've got homemade weights that you can use without having to go out and buy fancy equipment for it. So a lot of folks will ask us, well, what type of exercise is best for me? And I think a lot of this depends on what your goals are. If your goal is, I need to get stronger, then maybe you need to focus less on cardiovascular exercise like walking, cycling, swimming, and those sorts of things, and focus more on weight training. Okay? If your goal is weight loss or weight management, then typically a lot of times I'm going to recommend to patients that they focus more on the cardiovascular aspect, walking more, using the swimming pool, getting on an elliptical or getting on a recumbent bicycle or something of that nature. You also got to take into consideration what's your current fitness level. Not everybody in this room will start at the same level of exercise. They're not going to start doing the same exact thing. So sometimes you got to be aware of that. Physical limitations, again, do you have chronic pain? Do you have bad knees? Do you have bad hips? Do you have shoulder issues? We have a lot of patients that come in talking about having shoulder issues, rotator cuff issues. So you got to figure out what's your limitations. And then from that point forward, you can then start designing a program for you. Or we can help you design a program. Also, choose activities that are fun for you to do. I had a patient not too long ago that said, Jeremy, if you were going to buy one piece of equipment, what would it be? And I said, well, it's probably going to be the thing that you're going to use the most. If you hate walking on treadmills, don't go out and buy a $3,000 treadmill with all the bells and whistles on it. It's a waste of money. You're probably not going to ever use it. But if you're the type of person who says, man, I love going outside and walking, just find a nice neighborhood, find a nice park that's got a track in it. If you're the type of person that loves to cycle, look into going out and buying a bicycle. Go out and buy a stationary bike. When you go out to try these equipment out, one thing that I'll tell people to do, get on it while you're at the store. And don't just get on it for a minute or two. Use that thing, 5 minutes, 10 minutes. They don't care. They're in the market to sell something. So if they see you using it, they're going to leave you alone. They're not going to tell you to get off that thing because they think they're going to make a sale. So try some equipment out before you ever get it home, okay? I think the key point here is, just like Dr. Millstone was saying, the key point is movement. Just get yourself moving a little bit. And we're going to talk about designing an exercise plan here in just a second. So how do you get started? Well, I think the first thing you need to do is talk to your doctor. You need to find out if it's safe for you. And by that I mean, is there any other limiting factor that's going to keep you from being as active as you need to be? Choose activities that you enjoy. Start small and build up. How often do you need to exercise? Start out with 1 or 2 days a week. Work your way up to where you're doing 5 to 7 days a week if your goal is to lose weight. For example, if your pulmonologist said, hey, we need to get your weight under control, we need to get your weight down, then you're going to need to do more cardio than, say, the next average person whose goal is strength training because they just need to get stronger. So start out with maybe 2 to 3 days a week. Work your way up to maybe 5 to 7 days a week. Well, strength training, you don't need to do a lot of strength training. You don't need to use every piece of equipment in the gym if you go to a gym. Just do it 1 to 2 to 3 days a week. And focus on major muscle groups. Your chest, your back, your legs, your hamstrings, your quads, biceps, shoulders. Focus on those muscle groups, okay? Those are going to get you the most bang for your buck. And how long do I need to do this? Start out with maybe 10 to 15 minutes a day. Work your way up to maybe where you're doing 45 to 60 minutes a day, depending on if your goal, again, is related to weight management or weight control or weight loss. Interestingly, a lot of times people will come in and they'll hear us say, oh, I heard you needed to work out an hour a day. Well, yeah, a lot of people do need to work out an hour a day. Well, the patient will then say, well, there's no way I can work out an hour a day. That's fine. Do 10 minutes of walking 4 or 5 times a day. Boom, you've got the same health benefits as if you did a whole hour all at one time. You can break it down just as simple as that. So it doesn't have to be all at once. We tell our patients when they come in to see us that we do 45 to 60 minutes while you're here, but it's because that you're here. And you can stop, and you can take breaks, and you can rest if you need to. So when you hear about somebody saying, man, 40 minutes, that's a lot to bite off. Break it into small chunks. Make it reasonable for you. We've got some patients that do 15 minutes of walking in the morning. They'll come to rehab for maybe 30, 45 minutes in the afternoon, and then 10 or 15 minutes of walking at home later in the evening. They've got their 60 minutes or so of exercise that's already done, but they've broken it up during the course of a day to make it a lot easier for them to do that. So what type of equipment do you need? Well, if you've got a treadmill, if you've got an elliptical, if you've got a bicycle, if you've got something like this at home, that's fine. You can use that. But if you don't have to go out and buy fancy equipment. You can go out and walk on a track. You can use trails. You can use neighborhood streets. If you're talking about strength training, if you've got access to a weight machine or dumbbells, that's fine, but you can also get by using a simple chair. You can use, like I said earlier, just some bottles filled with water or sand, put them in a bag and just lift those up and down. You can do lateral raises, you can do front raises, you can do bicep curls, you can do shoulder presses. All of those are great ideas. Bands, have you guys seen these bands that they look like therapy bands, but they're a big rubber hose. They've got 2 handles on the end. They're fantastic. Go out and get you some of those. You can get those things at Walmart for maybe $10. They come in a set of 3. They're fantastic. You can stand on them. You can stand in the middle, grab 2 handles. You can do bicep curls. You can do lat raises, shoulder presses. Take your legs across. You can do squats with them, where you go down and back up to work the front of your legs. One thing that we use a lot of is just a simple chair at Diani. We'll have patients come in. They'll have them sit down in the chair. We'll say, okay, stand up. They'll stand up. We'll say, sit down. We'll have them do 10 to 12 of these, just like this. Fantastic. One of the best things you can do, because it strengthens the front part of your legs, which is your quadriceps, which are the muscles you have to have stronger so you can get up and down out of a chair, so you can get off the commode, so you can get up out of bed, so you can get into and out of a car. Those are perfect for you to use that way as well, okay? So I think the key point here is you don't need to have a bunch of fancy equipment. A lot of times you can find stuff really cheap at some of these stores like Walmart, Costco, Sam's, Dick's Sporting Goods. You can, everybody's got a chair at home. You can do that, set to stands, do that a couple of times during the day. So you really don't need a lot of fancy equipment to sort of get you started on an exercise program. There are some things, though, that you need to keep in mind when you're exercising. Just real briefly, you need to know, how hard am I working? How short of breath am I getting? We use a very simple 1 to 10 scale. Basically, 1 is it's really easy. I can do this all day long. To 10, being really, really hard, I need to stop. I need to stop now. Okay? Our goal for our patients is to have them somewhere between that 3 and 5 range. It's moderate. It's pretty hard, but I think I can keep going just a little bit longer. Okay? That little bit longer could be another 10 minutes, could be another 5 minutes, could be another 2 minutes. It doesn't matter, but they don't feel like they need to stop right then and there. Okay? So SpO2, check it before, check it after, check it during exercise. How many of you have your own SpO2 monitors? A lot of you in here? Perfect. Carry that thing with you. You can get those things pretty cheaply now. SpO2 monitor, it's called oxygen saturation meter. And basically what it does, you slip it on the tip of your finger. It gives you your oxygen reading. And what you want to do is, typically our goal when we have folks exercising with us in rehab is 88% or above. That's typically where we like to see most patients. We love to see them at 90% or above. But anything 88% or above, typically the patient can maintain that and they do really, really well while they're exercising. But again, check it before, during, and after exercise while you're working out. Supplemental O2 needs, what you're using at rest, you're going to need more when you're working out. And don't be afraid to turn your oxygen up. We do this a lot at Diani. It's very common for us to be able to turn the patient's the SpO2 up or their oxygen up during exercise. If you're resting on 2 liters, it's fine to stay resting on 2 liters. When you get up and you start to move, if you become more breathless, if your saturations drop, go ahead and turn it up to maybe 3 liters or 4 liters. Let your doctors know what you're doing so they have that knowledge of that, but just let them know that you're turning that up. Symptoms, monitor those: shortness of breath, fatigue, coughing. Is it getting worse? Is it getting better? Is it staying the same? Just make sure that you're aware of that as well. So where's the safest place for me to go? Well, a lot of people just choose to do that exercise at home. It's convenient. They have everything they need right there. And there's nothing wrong with exercising at home. We have some patients that come see us maybe 1 day a week, 1 day a month, and then we'll give them an exercise program and let them do that then at their own home, because it's just more convenient for them, because there's not a lot of pulmonary rehab programs around. We are one of the only ones in Middle Tennessee, and we have folks that come to us 1 day a week, maybe from, or 1 day a month, maybe from Chattanooga, maybe from Clarksville down, people from, we have some folks that literally move to our area for a month or 2 just to kind of make sure that they're safe to exercise, maybe from Memphis, and they'll come and visit us as well. Local gyms, YMCAs, Planet Fitness, those facilities are great. They offer you just a little bit more supervision, But, in the event of an emergency, they're probably going to do call 911. Their staff may not be fully trained to take care of a widespread sort of emergency, and then supervised pulmonary rehab. This is what I specialize in as far as our pulmonary rehab program. But the key point is you got to determine what's your level of comfort. Are you comfortable working out at home? If you are, it's a great place to be at. It's a great thing to do. You can get all the same benefits. You're just not getting those documentations to your doctor and those sorts of things. Local gyms are great as well. If you're comfortable going in and working out at a Planet Fitness or a YMCA, the one thing that I would probably recommend that you do as a patient or as someone suffering from pulmonary disease is take you some sort of hand cleaner or sanitizer in there with you. Not everybody, when they get off of an equipment, is going to wipe everything down like they should. So you got to be your own best health advocate there and wipe those machines down. Take the Germ-X with you. Don't be afraid to pull the Germ-X out. Wipe your hands down really good before and after you get on a piece of equipment. You want to make sure that you're taking the best care of yourself that you possibly can. So how many of you have been through pulmonary rehab? So we've got several. Okay. Well, really, what is pulmonary rehab? We kind of classify it this way if you were to take this straight off. Well, I did take this straight off of our brochure, so that's exactly where it came from. But it's a program designed specifically for the individual who suffers from some form of chronic respiratory illness. The primary goal is to address limitations and restore quality of life, and it's accomplished through progressive exercise plan or training and pulmonary education. So we are a little bit different than your standard exercise program. We're going to tailor a lot of stuff directly to you. We're going to do an orientation, an eval process. We're going to do an intake. We're going to find out a little bit about you as a person, what brings you to our program. We're going to find out a little bit about how you're doing. We'll ask you a lot of how are you questions. We'll do a lot of monitoring. So when you come in to work out with us, saturations are monitored. Oxygen is typically provided to the patients. A lot of safety involved, so you've got somebody there sort of watching over you, maybe not necessarily in a one-on-one manner while you're exercising, but making sure that your oxygen saturations are staying up, making sure that you're feeling okay, that you're comfortable, that you're not having any sort of anxiety while you're working out. We'll figure out what your oxygen needs are. We have folks that come in all the time where their O2 companies come in and dropped off a tank for them and said, okay, the doctor says you need to have this on 4 liters. They'll come and be with us for a couple of sessions. We find out, well, you don't need to be on 4 liters all the time. You need to be on maybe 2 or 1 when you're resting. You need to be on 4 when you're up working and exercising, but then you can take it back down to 2 or 1 when you're resting. And then one thing that we kind of do a lot is communication with your doctor. At Vanderbilt, we can send a message to your doctor just right away while you're basically still in pulmonary rehab. We can send progress notes to them that goes directly into your medical record so that they can find out, okay, I've referred this patient to pulmonary rehab. This is what they're doing. This is what they're up to. This is what their limitations still are, but this is what they're able to accomplish now. So who can benefit from pulmonary rehab? Really anyone. Really anybody can benefit from it. If you've got pulmonary issues, if you're somebody who struggles because of shortness of breath and it's just impacting your normal daily routines, you can benefit from this. It's basically supervised exercise is what it is. And with constant communication back to your doctors, okay? So what will you do? Exercise, exercise, exercise. That's the big crutch. We do a lot of exercising, a lot of set to stands, a lot of supervised exercise goes on. We have breathing classes, we have education programs. If patients do come in and they are currently smoking, we offer smoking cessation for them as well. I would say that this bottom number here for smoking cessation is probably decreased. We have less folks that are referred to us now that are smokers. We used to have a lot, and we used to offer formal smoking cessation, but we still do that if needed. And the reason that you have a component like this, of breathing classes, education, smoking cessation, your insurance. If they're going to pay for you to go to pulmonary rehab, they want to make sure that these 4 things are covered while you're in the program. So that's the big thing. That's why you have a lot of these other sort of various programs offered in there. So when you come into exercise, first you have your orientation and your eval. We want to just find out how you're doing, what's going on. We want to find out what your goals are. Come up with a plan. Our individualized plan is basically custom to what your goals are and what you're able to do. We never want to, throw somebody on an elliptical who's never been on an elliptical before and thinks, oh, there's no way I can do this. And then find out halfway through, well, they were right. that we shouldn't have done this. So it's a plan that's put in place for you. There's a lot of safety. We monitor you constantly. And attendance, we come up with a plan for you. How often should you come? Is it 1 day a week? Is it 2 days a week? Should I come 3 days a week? Can I come once a month and then do the rest of this on my own at home? Breathing class, Dr. Millstone alluded to pursed lip breathing. How many of you have heard about pursed lip breathing? Good. How many of you think you do an excellent job at it? Good, good. I'm glad to see that go up. So in our breathing classes, this is probably, there you go. There you go. So pursed lip breathing, diaphragmatic breathing, those techniques are taught. We try to help you cope with your dyspnea as much as we can. It's really emphasized quite a bit. Anxiety, we see a lot of patients come in the first several weeks they're there where they get to exercise and they get real nervous. And the first thing that happens is their breathing happens and their shoulders go up to their ears. Up and down, up and down, up and down. What we try to do is to slow that down a little bit. Let the patient know, say, hey, you're doing well. Everything is okay, but we just got to relax just a little bit. And we try to give that as much as we can. Pacing, not only pacing while you're in rehab or while you're on the exercise floor, but also more importantly, while you're at home. Okay, because when you come to see us or if you go to any pulmonary rehab program, you're really only going to see those folks for maybe an hour a day, maybe 3 hours at a week at most. So you got to really be comfortable and sort of get yourself comfortable, being able to pace yourself at home, pace yourself when you're exercising. And then we also do give functional home exercise routines. A lot of the stuff that we cover in breathing class are then things that you can take and apply when you're not in rehab, okay? Education, we typically offer a monthly education program for all of our patients. It's open to family, it's open to friends, but it's one of those things that it's required by all of our patients to go through. We typically cover these 6 topics here: medication and exercise adherence, finding out, why you're on a particular medication and why it's important for you to take it on a regular basis. Nutrition for the pulmonary patient, we have a nutritionist that comes in, or a dietitian rather, and she covers a lot of this. Then we talk about benefits of exercise. We'll cover and talk a lot about what the various pulmonary diseases are. We'll talk a little bit about lung anatomy, physiology, try to break it down to its easiest form, and then also medications. Find out why and when it's important for you to take certain medications, and why it's best to take them at certain times. One thing that we have started doing is it goes back to medications, and also what Dr. Millstone talked about was we've started having a lot of our patients take a puff on their albuterol inhaler about 30 minutes before they come in to work out. What we have noticed is if they do that, if it takes them 30 minutes to get from their house to the Vanderbilt campus, take it before they leave, and by the time they get to Diani and they start rehab, it's remarkable how much better they feel and how much better they do when they're working out. Smoking cessation, one of the things that we try to do is we try to implement this as much as we can, but you got to at least be trying to quit. If you're someone who comes into our program, or any program for that matter, and you're still smoking and you have no intentions of quitting, maybe pulmonary rehab is not the right place for you right now. Because there's probably a lot of other people that are there and they have quit, or they've recently quit, or they're struggling with quitting. And you just don't need that around those individuals in that type of environment. We do have resources available, and of course we do a lot of smoking cessation counseling up on the exercise floor. And we also have a registered nurse in our program that talks a lot about that with patients as well. So what are some other resources that you need, especially that we have at Diani? Well, I mentioned the dietitian and the health psychologist. But we also have physical therapy, so we have a lot of patients that come into our program that maybe because of various orthopedic issues, they just can't seem to get around a lot. Maybe they do have bad hips. Maybe they do deal with a lot of chronic pain issues. Well, a lot of times we'll refer them to physical therapy first. Try to get some strength and some mobility back, and then let's try pulmonary rehab later. Or let's try to get you a home exercise program together later. Medical fitness team, we offer a membership program at the Vanderbilt Donnie Center, and as far as our membership population, close to 100% of our members are former patients in one of our programs, whether it's cardiac rehab, physical therapy, cancer wellness, pulmonary rehab. So it's sort of a fitness center or a medical fitness center where patients that have chronic lung diseases or chronic conditions in general can feel like they can come and exercise without feeling embarrassed or awkward or like somebody staring at them like, I just can't do this. Everybody that's in our program has been in that same boat before. So a couple of final notes with pulmonary rehab. If you have not been through pulmonary rehab, I'd certainly recommend that you at least look into it. It is covered by most insurance companies, not all insurance companies, but at least most insurance companies will cover pulmonary rehab. There are a lot of criteria that you have to meet. The biggest thing is if you've had a PFT in the last year, a pulmonary function test in the last year, if it has met certain criteria, if the numbers are down low enough, a lot of insurance companies will cover you to do pulmonary rehab. You do have to have a physician that refers you there, so talk to your pulmonologist, talk to your doctor about that, see if there's a local pulmonary rehab program in your area, and then see if they'd be willing to make a referral for you. I will point out, if you have Medicare, one thing that has happened with pulmonary rehab, Medicare only gives patients a lifetime number of visits. So for pulmonary patients that come to pulmonary rehab and they have Medicare, Medicare will only give a patient 36 lifetime visits. So from the point you start rehab, that's all that they will allow you to have. So what we typically will do is we'll bank some of those visits. We'll have a patient come in and we'll say, hey, you only get 36 lifetime visits here. Let's do a month of rehab, get you an exercise program that you can do at home, stop at those 12 visits so you've got 24 left in case you were to get sick, you were to get worse, or maybe you have a lung transplant in the future and you need to come back. You've got visits where your insurance will pay for it. But we may have them come back once a month, something like that, just so we can kind of check in and see how they're doing. Okay? This is my contact info, so if anybody has questions, comments, you want to shoot me an email, you can certainly do that. I was trying to get out of the office yesterday and I didn't get any business cards, so this is all I got. That phone number goes directly to the Downey Center, so if you're interested in pulmonary rehab and you're interested in doing it at Vanderbilt, you can call that number. You can ask for me or anybody in the cardiac or pulmonary rehab program. I think I've only got 2 more slides here, so does anybody have any questions? Yes, ma'am. There you go, thank you. Yeah, it is important. Don't let the thought of being active and exercise scare you. You know, anybody can be active. You just got to really find out what your limitations are. And it's a lot easier to do that when you've got somebody sort of guiding you and holding your hand while you're doing it. We've had folks that have come in before, like you said earlier, we've had folks come in before in wheelchairs, pushing wheelchairs, maybe have their tank sitting on the arms of the wheelchair. By the time they're leaving, they're walking laps around the track, or they're walking back and forth to their car out in the parking lot. So, you know, you got to find out what your goals are and what your limitations are and just sort of work toward that. Any other questions? Well, I'll be out in the back for a little bit if anybody does have any, but that's me.
Definitely.